I'd like to welcome Dr. Jan Christola back up to the podium to introduce our last speaker, Tamara Taggart.
Thanks, Janet. So how's everybody doing? Have you had an awesome day? Yeah, it's been an awesome day, hasn't it? It's been just great, and I'm glad you're having such a great time. I certainly have. I've learned a ton today, and it's been wonderful. I'm very excited to be here to introduce a wonderful woman who works so hard for our community, both on air and off air. And a woman who really, in the last few years, has come to be a very dear friend of mine. We've done a lot of work together, and it's been wonderful. Tamara Taggart is a veteran broadcaster, as you know, and she comes to the CTV anchor chair with a lot of experience, passion, and a deep understanding of what really matters to people in Vancouver and throughout the province of BC. She has covered so many issues pertinent to this community here in the room today, and her passion really goes way beyond her time on air. I got to know Tamara when Laurie Clark and I from the foundation actually went to ask her to be chair of the BC Women's Neonatal ICU fundraising campaign, and we were thrilled when she agreed to do so. So it's been really wonderful doing that. She committed to help us raising $17 million for the neonatal ICU at BC Women's, and we're almost there. It's been an amazing time, and we're just winding down to the end of that campaign. Tamara's chaired many other things as well. She's done major fundraising for the BC Cancer Foundation, raised over $5 million at the gala this year for them. And she's also this year raising money for the Immunotherapy Clinical Trials Network. She sits on a number of boards, including the Kettle Friendship Society, the Pacific Parkland Foundation, and the Children's Wish Foundation of Canada. She's a big supporter of the Developmental Disabilities Association and the BC Centre for Ability. She's also a founding board member of the Rare Diseases Foundation. So as you can see, her roots are deep in this community and her passion is strong. Tamara recently gave a TED Talk called Two Conversations That Changed My Life, and she compared the conversation she had with doctors when she was told that her son had Down syndrome to the conversation with doctors when they told her that she had cancer. Tamara is a strong advocate for her son and others with special needs, believing that we are all more the same than we are different. Tamara lives in Vancouver with her husband David, a music producer and the lead guitarist of 5440, you may recognize that name, and together they're happily raising their 3 children, Beckett, Zoe, and Poppy. In, I think it was 2015 when you were awarded the Order of BC, which you, of course, deeply and strongly deserved. And I'm very happy to welcome my dear friend and colleague to the stage right now. Thank you.
Yeah, you're so sweet. Thank you so much, Jan. Hi. Okay, so can you hear me? Because I have a lav mic on. It's all good, right? Okay. If you can't hear me, just let me know. I should know how these microphones work. I'm thrilled to be here, and I'm not here as a news anchor. I'm here as a mom. My son Beckett is 8 years old, so I still consider myself a new mom because I learn something new every single day from my kids. But one of the biggest lessons that I think I've learned in the past 8 years is language and words and tone and how they mean so much, especially to a new mother and especially to the parents of a child with special needs or a disability. Because it really does, those words at the beginning set the tone for years. And you can talk to a lot of parents who will remember something negative that somebody told them the day their child was born forever. They will remember it when their child's 50. You just don't forget that. And I never really considered it before. And I guess one of the big things that I'd never wanted anybody to say to me was, I'm sorry. It's the worst thing anybody could say to me was, I'm sorry. So I think what I'll do is I'll start at the beginning with my pregnancy. When I was pregnant, never been pregnant before, had no idea what to expect. I just thought it was all puppies and kittens and I was going to have a baby and it was all going to be great. And that's how I felt. But then people started talking about getting testing and this, the triple screen and the this and the that and amnio and all this stuff that I'd never even really thought about before. And so I was told that I should just have a nuchal translucency test and then that would cancel out everything else. Like I wouldn't have to worry about all the other tests. And I said, okay, well, what do I do? And they said, you go at between 10 and 13 weeks and I had to pay for it. So I think I paid like $500 at the time. I think it's free now. And I was told it's 99% accurate. And I said, for what? And they said for Down syndrome. And I had never even thought about Down syndrome before. And so we went for the test and I came back a little while later, like 2 weeks later, whatever, you come back. And the doctor said to me, your test results are amazing. And I said, oh, that's good. And he said, you have like a 1 in 1,000 chance of having a baby with Down syndrome. And I said, oh, okay. And then he said the weirdest thing to me. I thought it was the weirdest thing. He said, and tell me if you think this is weird, maybe you don't, but I do. He said, you have the same chances as a 15-year-old. And I just thought that was such a weird thing to say to a woman in her 30s. Like, I think what he was trying to say is that, my chances of having a baby with Down syndrome were slim to none, basically. So I crossed it off my list of things to worry about, even though I hadn't really worried about it. Every time I turn here, I get a little bit louder, just a little bit louder this way. And I just carried on, and I had a perfect pregnancy. I mean, it really was a perfect pregnancy. I'm pressing the buttons. I don't know what's happening. There we go. So I did have a really good pregnancy. I was happy. I was healthy. Every ultrasound I had was great. I didn't have amnio because they told me I didn't need to have it. I didn't do any of those things. And in hindsight, I'm really glad I didn't. I am really glad I didn't. Because I'm not sure that I would, I'm not sure, I don't know, I think that fear would have taken over. And I think I probably would have made some decisions that maybe I wouldn't have had the right information about making. So I feel everything turned out for the right way, but I had this nuchal translucency, but what it did for me, all those questions, it created worry in me that I never knew I had to be worried about. I never knew I had to worry about Down syndrome. I never knew I had to worry about, cleft palates and all these other things. That now, as a mother, I realize I actually don't have to worry about those things. Those are all things I don't have to worry about. There's way worse things in life to worry about than Down syndrome or a cleft palate or, a missing finger or something like that. There are so many more things. And I think anybody in the room that knows anybody that's had cancer, if you've had cancer yourself, that's a good thing to worry about. That's valid to worry about something like that. But Down syndrome just really isn't. So the more I talked to other people, the more I started to worry. But I didn't worry about Down syndrome because I was told I had a 1 in 1,000 chance of having a baby with Down syndrome, and I had the test to do it. So Beckett was born on, okay, my button doesn't work. There we go. Beckett was born on August 2nd, and I had a C-section. I had to have a C-section, so we were in there, and it was... It's amazing what you remember from a birth, right, when you think about that day. When Beckett came out, my husband is half Japanese. And so when Beckett was born, the doctor said, and Dave, that's my husband, what is it? And he said, it's a boy, and he looks Asian. And he was so happy, right, because he thought there's no way he's going to have an Asian-looking baby. And the pediatrician, who's Asian, turned to Dave and said, are you Asian? And Dave said, yeah, I'm half Japanese. And she said, oh, okay. And in hindsight, she knew that Beckett had Down syndrome. Do you know what I mean? And so she immediately asked the question, and then she thought, okay, well, maybe this is all in hindsight. Maybe that's why he has an epicanthal fold on his eye. Maybe that's why he looks so Asian. And when Beckett, in the lower corner there, that's really the first time that I saw Beckett. I knew in that moment that Beckett had Down syndrome. I knew he did. And my first thought was, wow, I had a baby. And my second thought was, I think he has Down syndrome. And I said nothing to anybody, not even my husband, because I was waiting for somebody to say something to me, and they didn't. And so we went back to the hospital room, and I literally, in those other two pictures, like I feel like I was just I was totally not present. All I could think about was, why is nobody saying anything to me? Why is nobody saying anything? And so we carried on about our day, and my phone rang, and it was my doctor. And she had gone back down to her cabin. She came up to deliver Beckett, and she went back down to her cabin, and she said to me, I need to talk to you about something. And I knew what she was going to say. And meanwhile, my work wanted to send a camera to come and film me and Beckett, because I'd been on the cover of a magazine pregnant, what's Tamara going to have, and all this stuff. And she said, I think you should tell work not to come with a camera. And I said, why? And she said, well, because I just think that we need to do a blood test. And I said, why? And she said, because I think that Beckett might have Down syndrome. And I said, well, what makes you think that? Even though I knew she was right. She said, well, there's nothing for sure. There's just a few physical characteristics. And she was very gentle about it. And I said, okay, let's do the blood test. And then I remember the nurse came in to take his blood. And she was like, well, I just took blood from this baby. Why do I got to take more blood from this baby? This poor baby's feet are... And I was just like, oh my gosh, just take the blood, please. Please take the blood. And she was complaining the entire time about taking Beckett's blood. And Beckett was born on a long weekend, so of course off went the results, and we didn't hear for 5 days after. He was 5 days old when we heard. So I called off the troops at work. I was like, oh, I'm not feeling very well. He has jaundice. It's not good. Like, we need a little time. And that's kind of where we stood. And we went home, and then that's where it all started to unfold for us when it came to language. So our pediatrician became our pediatrician. The one that's in the delivery room becomes your pediatrician. And she phoned us, and my husband, we had a house full of people. And meanwhile, we'd been Googling, which is the worst. I know it's the worst thing to do. It's the worst thing to do. I learned my lesson the hard way. I always tell people Dr. Google is an asshole. Like, he really is, And because when you Google Down syndrome, it's not good times. It's really not. I swear every photo, it's better now, but every photo looked like it was taken in 1962. And like nothing had ever been updated, and everybody had a bowl cut. I'm like, really? Like, did everybody have a bowl cut that had Down syndrome in the city? Like, it's crazy. And I just kept saying to my husband, like, I don't think he does. And my husband was like, I think he does. And it just went back and forth and back and forth. And it was awful. So a phone call came. It was our pediatrician. And she said, we were both on phones in our bedroom, house full of people downstairs, holding Beckett and passing him around. And that was where the tone was set. She said, I'm so sorry. She said, but it's confirmed Beckett has trisomy 21. And I said, oh, and she goes, I'm so sorry. And her tone was so sad. And I felt sad, and I started crying, and Dave started crying. And she started listing off like, oh, I said, well, what do we do now? And she said, well, you need to go and have this test, and then come in and see me, and then we got to go to this, and you got to go to that, and you have to go to, have his hearing tested and his eyes, and we have to do this, and I was just like, oh my gosh. And so we hung up the phone, and we cried. And when I think about those tears, I was crying because I didn't know anybody with Down syndrome. I knew nothing about Down syndrome, and I was scared. And I knew that most women that find out they're pregnant with Down syndrome terminate the pregnancy. And I felt embarrassed. I really did. And it's a horrible thing for me to admit, but it's really the only way that I can describe it. And I don't think that I'm alone when I say that. I felt embarrassed. I just thought, now I have to tell everybody that I didn't have a perfect baby. And I think of that now, and I can't even believe I thought that. And so Dave and I looked at each other, and I said, okay, we need to smarten up. We need to stop crying. We need to go downstairs, and we need to tell everybody, and we can never cry again in front of anybody. And he said, okay. And such a good husband. And I said, because we are the captains of Beckett's team, and everyone is going to look to us and how we act. And if we go down there and we're sad and we're crying and we're scared and all those things, then everybody else will fall in line with that. So we just didn't do that. We went downstairs, and I said, I was just like, well, it's confirmed Beckett has trisomy 21, so I'm just going to go on Amazon and order some books, and he's still the same, and everything's good, okay? I'm just going to become an expert now. And they were like, okay. And I literally got on Amazon. I ordered every book there was on Down syndrome. And then it's a generational thing, right? My mom and my in-laws have a very different idea of what Down syndrome is. And people that are born with Down syndrome, they kind of go in institutions. When, for my parents and my in-laws, that's what they think of it. And so they felt sad. And we just did not feel sad, and we marched ahead, and I did become an expert pretty quick. That's a great thing about Amazon. Those books arrive fast, and you can start reading quite quickly. So, do you mind flipping it for me? So, this is what I wish somebody had told me when we were visiting all these doctors. We had a tiny little baby that we, took around, and we heard all the things Beckett wouldn't do from all these doctors and other, healthcare workers. We heard that, Beckett won't drive, and he won't go to university, and he probably won't have a job, and he may go to a regular school. Somebody told me that the worst part about somebody with Down syndrome going to school is that nobody wants to be their best friend. That's really awesome to hear when you're holding your brand new baby. And I heard all these things that Beckett wouldn't do. It's going to be hard to toilet train him. It is. It's going, he's not going to speak right away, and he's going to be really delayed. And I got a lot of pictures of Beckett to show you, so these are just a few, but he is the light of our lives, and he's the light of our daughters' lives, for sure, hands down. He is, like I said, he's 8, and yeah, he still wears a pull-up, and he goes on the toilet like 50% of the time. The other 50%, he doesn't. And I always say to people, well, he's eventually just going to go on the toilet. Like, he's not going to be 16. Yeah, he's not going to be 16 and wearing a pull-up. They won't fit anymore. It's not going to be an option. And part of it is my problem too, because, everybody's busy, right? And it's like, I'm like, okay, when I remember, he goes on the toilet. When I don't remember, I'm cleaning a pull-up. But he's an amazing boy, and it took time for everybody to sort of realize that. And it took courage from my point too, because when we had to go see the geneticist, when Beckett was just a couple weeks old. He was probably maybe 3 weeks old, and I had read a bunch of books, so I was pretty well versed in Down syndrome for sure. And we arrived at the geneticist's office, and it was the most horrible place. Sorry. It really was, and for anybody that has ever been in that room, first of all, it's so ugly. It's like there's no decor at all. And the decor that there is are like basically stats of all the things that can be wrong with your baby. And it's like, so I'm sitting there holding my brand new baby, and I'm reading about Down syndrome on there, and I'm just like, oh my gosh, could we not, they should have that up on the wall. That should be up on the wall. Hard to pick which one, but one of those should be on the wall. Because he's my boy, he's my light. But I didn't feel that. When we went in to talk to the geneticist, and I've gotten to know a lot of the geneticists pretty well, having been with the Rare Disease Foundation. And they're the nerdiest of all nerds, right? Like, they just are. But I always try to remind them that I'm not a science project here. He's a boy, and he has feelings, and and I always try to remind them of that. And I started talking about Down syndrome to the doctor, and he was like, oh my gosh, it sounds like you know everything there is to know. And I said, well, I mean, I don't, right? I'm holding a 3-week-old baby, and I've done a bunch of reading. But I want to know if there's anything I can do that will make Beckett's life better, or is he the way he's going, like, is he the way he's going to be right now, and nothing I do will change it? Or is there stuff that I can do that will make his life better? And he said, he is the way he is, and there's nothing you can do to change it. And I left, and I thought, I think you're wrong, because if Beckett was put in an institution when he was born, do you think he would be the same boy he is today? I mean, I don't. He might not even be walking. He wouldn't be talking. And so I disagree with that. And that's what I meant, and maybe it was taken the wrong way. I don't know. I mean, I know he's always going to have an extra chromosome. That's not what I was asking. I'm not an idiot, you know? Like, I know that we can't take that away. Although I did have people tell me that there were ways, if I listened to Deepak Chopra, there were ways to, and I was like, are you kidding me right now? He has an extra chromosome. It's crazy what people say to you. Crazy. The other thing that I really had an issue with was, well, obviously the word retarded. That's a bit of a problem. And I had doctors use it, and they didn't use it in a medical way. I had a doctor talk to me about how she was on Robson Street, and she saw a jacket, and it was retarded how expensive it was. And I'm like sitting there going, I'm holding my baby with Down syndrome. Like, do you not see that there's nothing? And so I went through a period where every time I heard somebody say that word, I became the R-word police. Like, I would stop them, even if I didn't know them. I'd be like, excuse me, can you please not say that word? And then my husband would be like, Tamara, like, you can't control everybody. And I'm like, but I can try. I could try, if you don't mind flipping it for me. And we saw a lot of specialists. And this is just, you know, he is cute. But you know, we did the sleep apnea. We see the eye doctor all the time. I mean, we've seen it all. And at first, I looked at it as a negative thing, but I don't look at it as a negative thing. I look at my 2 typical daughters, if you will, and they never see anybody. Like, they never get checked. They get checked at school on the fly, you know, for their eyes and their ears, and that's about it. So I look at it as a blessing, really, that he has so much attention. And we've been really, really lucky. But I will tell you just a short story about the first time I fired a doctor. And I didn't even know you could fire a doctor. And once I fired my first doctor, I mean, that was it. I was just, you couldn't stop me. I was like, you better be good or I'm going to fire you. We were seeing an eye doctor. Beckett was diagnosed with cataracts when he was 1. He was about 10 months old. He was diagnosed with cataracts. And we go every 6 months and get them checked. And thankfully, they've never grown or anything like that. And they're kind of like not near his lens. But we had an eye doctor, and I asked a lot of questions because I was scared of cataracts. The only cataracts I knew were the ones that my dad had, and he had to have them removed. And I thought only old people got cataracts, and it scared me. So I asked a lot of questions, and I kind of got scolded for asking too many questions. And I was pregnant with Zoe. So I was in with Beckett, and I said, you know, if Beckett needs to have surgery, what are the chances that he could go blind? And she was like, oh, that's ridiculous. He won't go blind. And I said, well, but don't you replace the lens? And how do you know, like, he's so little, like, how would you know if it's the right lens? Like, I just don't understand how that works. And she said, well, you're putting the cart before the horse. And I said, okay, well, I'm just curious because all I have is Google. That's all I have. If you're not going to answer my questions, I have no choice but to ask Google. And it doesn't make sense to me on Google. And so we went to go leave, and I was standing there, and Dave had the stroller for Beckett. And they looked at me and said, so you're having another one? And I said, yeah. And they said, did you do testing this time? And I didn't even know what to say. I think I turned 50 shades of red. And I just said, yeah, I did. And I did. And then she said to me, oh, and she looked over at Beckett and she said, well, you're really brave. And I went into the washroom because I thought I was going to kill them. And I came out and I said to my husband, we need to go. I need to phone the doctors. We're getting a new eye doctor. And he was like, oh my God, what happened in there? And I told him. And for me, I just thought, if my son ever needs to have surgery, I don't want you to do it. Like, I just don't want you to. So when I phoned the pediatrician, I said, I want a new eye doctor. They were like, oh my gosh, Tamara, you know how long you're going to have to wait? I said, I don't care if I have to wait 3 years. I want a new eye doctor. I'll see this one until then, but I want a new eye doctor. And I got a new eye doctor, and I love her. She's amazing. I don't need to be best friends with my doctor, but I need to respect them, and I need to think that they respect me, and I need them to talk to me like my son is a person, not a problem. And I really felt like it was a problem. So I talked a lot about, in my TEDx talk, about, just language and how with Beckett it was, all the negative stuff I was given. No one told me anything positive. They really didn't, except for when they said, Jen and I were just talking about this, the word they. The word they is a really awful word. So I would have said to me, well, they're such happy kids. Oh yeah, they can be really stubborn. They can be stubborn. It's like, well, who's they? They, as in everybody with Down syndrome is they? Everybody with Down syndrome is happy? Everybody with Down syndrome is stubborn? I mean, Beckett is stubborn, but so am I. That's why he's stubborn. Beckett is super happy, but he's happy because he lives in a loving home, not because he has an extra chromosome. Beckett also gets pissed off too, which is what all kids do. And so that word they is really, if there's a lot of women in this room. If we were always talked about as they, we wouldn't like that. And the other way with words, and this comes up a lot at my work, is defining somebody by their challenge first. And it's a real problem on television. It really is. It's a problem in print. It's a problem everywhere. And after a lot of discussion, we had it changed it's changed in the CTV News handbook. You never describe somebody by their challenge, ever. They're not a Down syndrome child. They're a child with Down syndrome. They're not, an autistic boy. They're a boy with autism. And the word suffer. I've heard people say, oh, he suffers from Down syndrome. He doesn't suffer. Like, does that look like a boy that's suffering? He's not suffering at all. He's happy. And so at work, we run into that problem where people and they don't mean it to be mean. They really don't mean it to be mean. They're just describing something, right? You've got a short headline to write online, and so you write Down syndrome boy is lost in woods. That's fine to them. But I read it and I'm like, oh gosh, that boy is lost in the woods. Who cares if he has Down syndrome? It doesn't matter. It has nothing to do with him being lost in the woods. So it's been a real challenge getting that changed. But we don't do it at CTV anymore. And I was watching the national news one night, and they did it on the national news, and I lost it. It was a couple of months ago, and I was like emailing everybody in Toronto. The balls, really, for me to do that. I was just at home going, oh my gosh, they cannot do that. And it was a story that our Washington Bureau person had done about a child. And I was just like, we cannot say that in a story, because every parent out there that has a child with special needs, that's all they heard about the story. I didn't even know what the story was about. The only part of the story I heard was them describing the boy, and the boy being autistic had nothing to do with the fact that he had been killed by a bus driver. It had nothing to do with it. Do you know what I mean? It was like, but that's all I heard, and that's all anybody heard. And I guess in some ways people could argue that, oh, you're being too sensitive, and I mean, really. But I just think it's for the greater good. I think that all of us in this room probably know that, but there's a lot of people that don't still. And yeah. So when I was diagnosed with cancer, I talked about this in my TEDx talk. When I went to go see my oncologist, he was so amazing. And when I asked him all the questions I had to ask him, he answered every single one of them. And he never seemed rushed. And he told me that things were going to be okay, and that he was going to do his best, and that I was really lucky to have this medication to go on. And everything he said to me made me feel better. Everything he said to me. I even said to him, is this going to be what kills me? And he said, in the short term, no. In the long term, not if I can help it. And I left and I felt so good. And he said, Tamara, I want to give you my email address and my cell phone number. And I'm not giving it to you because you're on TV. I give it to all my patients. And I said, okay. And he said, if you have any problems, you text me or email me, and I will get back to you within 24 hours, I promise. And I said, okay. And you know what? There were times when I needed in the middle of the night, when I was on that chemo drug and I was violently ill because of it, and things were happening to me that I didn't know if they were normal or not, and I was scared. I was terrified. And I could text him, and then he would call me and say, you know what, Tamara? Totally normal what you're feeling. Let's do this. Why don't you try this? You know what I mean? And it was just like, I needed that. And I got another oncologist. That was the other doctor I fired. And I've only fired 2. And they, sorry, I try to be really careful. So my doctor, he was like the world expert in the type of cancer I had. I had a type of cancer called a gastrointestinal stromal tumor, and it's super rare, and mostly senior citizens get it, and it's 15 in a million people. And kind of like that 1 in 1,000 chance of having a baby with Down syndrome. So when anybody ever preaches numbers to me, I'm like, they don't, numbers mean nothing to me. Though if I could only win the lottery, it'd be great. But so he went back to the States, and I was lucky to have him for a year because he really did teach me how great an experience it really can be if you have somebody that you gel with. And most doctors are great. Everybody's, it's like there's good news anchors, and there's not so good news anchors. There's good baristas and bad baristas. It's no different in any job. And I think it's just really important to find somebody that you can gel with. And I didn't gel with my next oncologist at all because they put everybody in a box. And I would go and I would say, my liver levels are high and I'm a little worried. And don't worry about it, it's totally fine. Well, no, I'm kind of worried about it because they've never been high, and I think maybe I should have another blood test in 3 weeks. Oh, what was the word she used? I can't remember the word she used, but it was so offensive. And so it was so offensive I've forgotten it. But anyways, I demanded it because for me, it was the crazy in my head, right? Because I knew that my liver was probably fine, but the voices in my head were not going to stop until I had another blood test, and that wasn't going to be for another 3 or 4 months, and the crazy that would have gone on in my head would have been bad. So, I then changed oncologists, and I have a new one, and again, he's amazing, and he did the same thing. Here's my email, here's my phone number. If you have any problems, let me know. And I think that the majority of people would never abuse that. I don't know. But I've never abused it, but I know it's there in an emergency, and I know other doctors do the same thing too, and it's probably the best thing that a doctor's ever done for me is just giving me that little safety net when I'm really, really scared. So this is why words matter. So if you can read that, do you see where the issue is in the first line? Yeah, the problem with problem. So this is the place where I had my nuchal translucency done. And that's what's on their website. So if I'm a new mom, newly pregnant, and I go to their website to find out about their testing, and I read that, I now know that Down syndrome is a problem. It's a problem. And maybe it is a problem for some people, and that's totally fine. That's totally fine for it to be a problem for you. It has nothing to do with me. I'm here standing with an 8-year-old son saying it's actually not a problem. And so I look at that and I think, well, no wonder so many women are terrified when they find out they're having a baby with Down syndrome. I mean, who wouldn't be? It's everywhere that it's a problem. It's everywhere. It's a problem. And I mean, this is just such a subtle thing. I couldn't believe it when I saw it. I actually had to screenshot it because I could not believe it. And I screenshot this like about a month ago because I went back to their website to see what it said and see if they had new testing and all that sort of stuff. And I just thought, okay, well, if Down syndrome is a problem, then what else is a problem? And you know, that geneticist that I met with, he said something interesting to me. And I do think he's really right. He said, Tamara, in the grand scheme of things, Down syndrome's not a big deal. And I said, well, what do you mean by that? And he said, there are way bigger deals than Down syndrome. Way bigger deals. He said, you know, there's so many things that can go wrong. There's so many things that don't even have a name. There's so many things where it's only one child in the entire world that has it. And the parents don't know what to do, and we don't know how to treat the child because there's nobody else like them. They're unique. And it's true. Everything I need to know about Down syndrome, I ordered on Amazon. And now I know about it. And now I know so many other parents, and now I have a community, because the worst part is feeling alone. And, you know, I've said to other people, like, you can give people my phone number they find out they're pregnant, they can email me, they can do whatever, and I'm happy to talk to them. I don't place judgment on anybody with whatever decisions they decide to make at all. But I say the same thing to every woman I talk to, and I've talked to women who are in their hospital bed holding their brand new baby. I've talked to women whose husbands have just left them because they found out they're having a baby with Down syndrome, and they want to keep it and their husband doesn't. I mean, you name it. I've talked to women who their baby's a year old and they still haven't told their family. I've talked to every single kind of scenario you can imagine. And I say the same thing to every single person. I say, it's all going to be great. It really, truly is. I promise you it's going to be great. And you don't think it now, and I didn't think it either when I was in your shoes, but it really is going to be great. And it is great for me now. It wasn't great back then, and if I could go back and change anything, I would change those first tears. I really, truly would. And if I could change anything else, I would go back and I would correct the people that spoke to me in a way that I found offensive. I would have the courage to say, you know, Beckett's really skinny. He's super skinny, and he's a little guy. And we were concerned, so we went to the doctor, and I was really anal, and I used to write everything down that he ate, like from the day he was born until he was like 6. My husband's like, honestly, Tamara, are you going to write, when he's 16, are you still going to be writing down his food? I said, I might. Because he was so skinny, and I wanted to make sure he was getting everything he needed. And we went to the doctor, and I said, you know, he's so skinny, this is what he eats, here's his food journal, and the doctor said to me, don't worry about him being too skinny, he's got a lifetime of being overweight ahead of him. And if I could go back, I would say that is an old way of thinking. That is so old. Maybe if Beckett was thrown in an institution, he'd be overweight. Maybe he would be, but he's not. And I don't know any kids in his circle that have Down syndrome that are overweight. None of them are, because we don't put people in institutions anymore like that. And he's in sports, and he eats healthy, and he doesn't eat McDonald's and all that sort of stuff. So I wish that I had the courage to kind of go back and just gently say, you know, I have that now, and it's easier for me now. And I feel like, you know, I'm not an idiot either, right? I know that what I do for a living kind of changes the way that people act around me. And so my experience is maybe not as intense as some other people's, because a lot of people pussyfoot around me because they don't want to screw up. And I mean, I'm just being totally honest with you. But people still do. And I hear the stories from all my friends, and the stories that, you know, the things that are said to them when they go in for their amnio and find out they do have a baby with Down syndrome. And nobody has the conversation with them about, the positives and the negatives, the challenges and the triumphs. It's just the negative. And when I think of that, I think about, okay, the science, right? Like I try to look at it as a scientist and not as an empathetic mother. And as a scientist, for sure, you need to have the facts and you need to know, right? But a scientist put that on their website. A scientist put that Down syndrome is a problem. And you'd be hard-pressed to find somebody, in my circle anyways, and I know dozens and dozens and dozens of parents, none of them would tell you that it's a problem. None of them would. And I think that, the first people that we meet as parents, as new mothers and new fathers, are the nurses in the hospital. And we had a great experience with the nurses in the hospital. And I think they all probably knew that Beckett had Down syndrome, or they thought that he might, but no one said a word and no one acted any different. They just acted they were showing us how to give him a bath and all this stuff. We didn't know what we were doing. And they were all amazing. And so, that wasn't a bad experience. It became bad once we knew he had Down syndrome. And once we started seeing all these different specialists and just getting pounded with so much information. And, just before I wrap up, there's just a couple more things that the other thing that when it comes to language and when it comes to, I guess, transparency, it's funny, I wasn't planning on mentioning this, but Beckett ate pureed food until he was 5. And I couldn't get him to eat solid food. I tried everything and he just wouldn't do it. I couldn't get him to eat it. And so we just took everything we ate and we pureed it and he ate it. And he went to kindergarten eating pureed food. And I really wanted him to eat with the kids in the gym. That's where they all eat. But he couldn't. He had to eat in the physio room with the other kids with special needs. And it was really important to us to get him with the other kids socially. And so we had an appointment and we went to Sunny Hill. And we waited months to get into Sunny Hill. And I brought my food journal. And I said, here's, we put Beckett in a high chair. He's, like I said, he's a little guy. And we fed him and they watched how we fed him and everything like that. And they looked at his food journal and they said, okay, well, his nutrition is amazing. This is amazing what he's eating. He's getting everything he absolutely needs. He's getting this many calories. This is perfect. And I said, yeah, but he's eating smooth food and he's 5. And they were like, yeah, we think that's maybe a behavioral thing. And I said, okay, so what do I do about that? Well, we can't do anything about that here. And I said, okay, so what should we do? And they said, well, you probably have to see a food psychologist or something like that, a behavioral psychologist. And I said, oh, okay, sure. Let me just get my pen. So who would we see? Oh, we can't give you any names. You can't give me any names. No, we're not allowed to give you any names of any people. We're not allowed to do that. And I just thought, well, where am I? What do you mean you can't give me a name of somebody that can help my son eat food? And our occupational therapist from the Center for Ability was there too. And I said, do you know somebody that can help me? And she said, yeah. I said, can you give me their name? And she goes, no, I'm not allowed to. And I'm like, okay, well, this doesn't make any sense to me. And so when we walked out to the parking, I said to her, why can't you guys tell me who can help Beckett? And they said, because we're not allowed to endorse anybody. And I said, okay. I said, so can you please give me the name of somebody? And she said, I'll give you the name of somebody. And I said, okay. So I got a hold of a woman, and I've given her name to everybody, by the way. It cost us a pretty penny. I'm not going to lie. It was a fortune. I think it should be covered in some way, shape, or form, because I think that eating food is a human right. But it probably cost us, I would say, between over a year and a half, it probably cost us about $12,000. And she had Beckett eating cheese and popcorn in the first week. It was unbelievable. And I gave her name, I swear I gave her name to everybody because everybody was in the same boat as me. And I found it such an odd thing that I get the not endorsing thing. I totally get that. But aren't we all trying to do the same thing here? Aren't we all rowing in the same direction, trying to help mothers and babies and children and women? And so sorry, it's a little bit of a sidebar, but it just came to my mind about Beckett and eating. Do you mind forwarding it? Thanks. Anyway, so Beckett has, this was last summer, and Beckett and Poppy, that's Poppy that he's kissing, she's 5, and she's 3 years younger than Beckett, and they have a very special relationship. And Zoe, our daughter who's in the middle there on the bottom, she's 7, so I had her, like it was Beckett's birthday, and then boom, I had Zoe really close together. Because I was so scared of dying after I had Beckett. I was so scared of dying and leaving him alone in the world. It was the most bizarre thing. Beckett was born, and I immediately wanted to get pregnant again. And because I thought Dave and I are going to die, and then we're going to leave this little boy alone in the world with special needs. And so then I had Zoe right away. And then I looked at her, and I thought, oh my gosh, I've left you with this big responsibility. I better have another baby right away as soon as I can. My husband was like, oh my gosh, are you kidding me? I'm like, one more. And I would have had one more, but that stupid cancer got in the way of everything. But I think this might be my last slide, is it? Oh no, there we go. So this is what I wanted people to tell me when Beckett was in my arms. I wanted them to tell me that one day we would do a project for 100 days of school in grade 2, and that I would walk to school and pick him up. And he would be so happy. And, you know, he is no different than our daughters, Zoe and Poppy. He is no different. His speech is a little bit delayed. You know, he wears a pull-up, but he feels and he loves. And, you know, I always say to people, you know what, Beckett's not going to be an astronaut or a brain surgeon or the prime minister, but either is your kid, so... Get over it. Anyways, just as I do say that a lot to people, and they're like, whoa. But I'm just happy to come and see you all and sort of share my experience about words. I work in a business where words really matter. And trust me, if we say one wrong word, the emails come flooding in. And, you know, and words do matter, and tone really matters. And I remember all the bad things that people said to me, or all the things that hurt my feeling, or the ones that felt like a punch in the stomach. And I want to remember the good ones. I want to remember, you know, I need to remember the nurse that took the time. You know, she was from Ireland, and she took the time to really show us how to bath Beckett and hold his neck and all that sort of stuff. That's what I want to remember. I don't remember the community nurse that came to the house. I don't remember so much of it because I think I was so focused on protecting my son and not feeling sad around him so that he didn't feel my sadness. And so words matter. They matter at work for me, and they matter at home for me. And you know what? I didn't even tell the girls that Beckett had Down syndrome until last September. I never even told them. I just never crossed my mind to tell them that he has Down syndrome. And then I thought, oh my gosh, they're going to hear it on the playground, and I need to tell them. So we were at breakfast, and it was in September, and I said, I've been meaning to tell you guys something. And they're eating their cereal, and they said, what? And I said, you know how Beckett still wears a pull-up sometimes, and he doesn't talk as much as us, and, you know, he goes to speech therapy and reading and stuff like that? And they said, yeah. And I go, it's because he has something called Down syndrome. And they went, oh, what's that? And I said, well, you know, he has an extra chromosome. And they said, what's a chromosome? And I said, you know, you have your cells in your body, because we were learning about, and I said, and there's chromosomes in there, and he just has an extra one. And they said, oh. And so he said, okay, so wait a second. Beckett has Down syndrome, and he has one extra chromosome? I said, yeah, basically. And she goes, oh, cool. And that was the end of it, and we've never discussed it since. She does want to do a project on Down syndrome for her classmates, because she saw I have a promo that's running on air, a PSA for the Down Syndrome Research Foundation. And she saw it, and she's memorized it, and she wants to do it for her classroom. So I said, sure, if that's what you want to do, no problem. But I don't know if anybody has any questions. I'm happy to answer any questions that anybody might have. We have about 5 minutes if anybody has any. Please, somebody have a question? Honestly, yes.
Please tell me some lovely, positive, affirmative phrases that some healthcare providers have said to you. Not that I need to memorize it, but we all come up against,
Yeah.
come across people who have some challenges with their baby.
I think the most important thing to say to somebody is congratulations when their baby's born, no matter what. You know, you have a beautiful baby, and nobody said congratulations to me. Nobody did. And I mean, my friends did, and of course. But nobody said congratulations, not one person. And I think it's such a simple thing. I think the worst thing you can say is I'm sorry. I really do. I think it's the worst thing you can say. Because if somebody would have said I'm sorry when I had cancer, I would have said I'm sorry too. Like, this sucks, But not when my baby is born. It's congratulations. We've got some reading to do, and we've got some, we have to figure this out. My doctor, when I was diagnosed with GIST, she didn't know anybody with GIST because it's so rare. And she was in the hospital because I ended up there in an emergency situation, and she said, I'm going to tell you right now, I don't have any patients that have ever had this, and I've been doing this for 20 years. I need to go study up now because I've never heard of this before. And I appreciated that because I didn't know anything about it. And I'll tell you what I didn't do. With Down syndrome, we Googled it. With GIST, I didn't Google one thing, nothing, because I thought I'm only going to get my information from somebody that went to school for a long time. Not somebody on a message board somewhere. But I think congratulations is the best thing to say to somebody, and just being supportive and listening. And I think sometimes we always feel like we need to fill the space. We need to fill that space with words. And a lot of times we don't need to fill the space. Sometimes a woman, just wants someone to be there and help them hold their baby, or talk to them about something else, or just hold their hand. I mean, it's amazing what a human touch does, right? If somebody would have just put their hand on my shoulder and said, your baby's so beautiful, look at him, that would have made me feel a million times better. Yeah. Anything else? Anybody? Really? Yes? Oh, yeah, breastfeeding. So I couldn't breastfeed. I had a feeling I wasn't going to be able to breastfeed because my boobs never got bigger when I was pregnant. And I was like, wait a minute, I'm supposed to have bigger breasts. I got ripped off here. And so I asked to go see a breastfeeding doctor. And I couldn't do it. After she squeezed my nipple like it was a zit, and nothing came out, and it was probably the most painful thing I've ever felt in my entire life. I'm not kidding. It was so painful. And so then she said, oh, there's nothing there. And then she said, now I have to do the other breast. And I'm like, whoa. These two are friends. If this one can't do it, I'm telling you right now, I don't even want to know if this one can. But no, I couldn't breastfeed. And I was worried about it. And the reason I wanted to get tested to see if I could breastfeed first, I had a feeling I couldn't. And was because I was worried about being pressured in the hospital, because I did hear nightmare stories about the nursing Nazis is what everybody called them. And it's true, right? I mean, I don't know if you've ever heard that before, but that's what my girlfriend is, and it scared me. And I just thought, what if I can't? And I go in there and I feel bad about myself, and I don't want to feel bad. I wish that I could have breastfed, and I couldn't. But I am glad that I found out ahead of time, so that I was able to beat myself up about it before I went in the hospital rather than during in there, because I was upset about it. I really was. Yeah.
I don't have a question. I just want to say thank you for you having the bravery to come forward and do your TED Talk also. I've shared it with my public health nursing colleagues, and it's really helped us to talk about language because it is so important. So thank you very much.
Oh, you're amazing. Thank you for saying that. Thank you. Oh, do you have a question? Oh, thank you. She said congratulations. You're so cute. Any other questions? Anything? I'll answer anything. I really will. I'm on a roll now. Yes?
Did you approach the clinic where you got your NT to talk about the language on the website?
No. And I mean, it's such a small city, right? So when I went back to my GP, and she said to me, she's like, oh my gosh, I just can't believe that this test was so off. And she said the doctor that did the test, that is at that clinic, is also her patient. I mean, how weird is that? And so she said, he feels terrible, and he feels, you know what I mean? And I was like, well, he should give me my $500 back if he felt that bad, because the test didn't work. But no, I've never said anything, and I've thought about it. I really have. The problem is that I could go two ways about it, right? I could just put that screenshot up on Facebook, and then it would go crazy, and, but that's kind of mean. And I could phone them and say something, and I probably should phone them and say something. But in ways, I have really mixed feelings about that place, I really do. And the reason I have mixed feelings is because somebody I know she was very newly pregnant, and she said, oh, I'm getting a test done, and she said what it was. And I said, oh, what's it for? She goes, oh, it's so I can find out the sex of the baby. And I said, well, you can't find out the sex of the baby until you have, the ultrasound or whatever, and it's, this many weeks. She, oh, no, there's a new blood test, and you can find out. I said, oh, my gosh, is that legal? I thought you couldn't do that. And so, of course, I started looking up online whether you could do that, and I got the name of the test that she was having, and I meant to ask you about it, Jan, and it's a test for Down syndrome and all that. But I guess you can also find out. They don't advertise that you can find out the sex, but we've done stories on the place in the States just across the line where you can go and you can find out the sex super early, and there was a problem with that because some people, they just want to have a certain sex, and so I found it really interesting, and it is the same place, and so there's a part of me that just feels really, I don't know, I just feel so indifferent about them, and I feel like my voice is in some ways better used doing something like this rather than, I think that collectively as a group, we have way more influence for what all of you do for a living and how you use your voices than I can have. Who knows how many people even go to their website, but you know what, I will call them because you're right, it is the right thing to do. Right? Did we just have a therapy session there? Because it felt a little bit like a therapy session, didn't it? Thank you for that. How much do I owe you?
I'm sure, well, I hope the clinic would appreciate getting that feedback because they might not even think twice.
Yeah. But when you saw it, did you think it was weird being a communications person?
Yeah, we've never used problem on our website.
Yeah. I mean, for me, it just seems like common sense, but you're right. Maybe they,
But you're right, it's the first thing they say.
Yeah. Yeah. Yes, Jen?
So I was just going to say, Tamara, though, to that question about language, I think the medical profession is sort of notoriously bad with that sort of language, especially historically. And I think we're learning about it. But the whole idea of vicarious trauma and how you actually re-traumatize people with the way you talk to them, that's a relatively new thing in the medical profession. And I think maternity care has always been a little bit better than the rest of the medical profession, but still, not that much. So historically, it's all been about risk and abnormality and making sure that you're normal and all that stuff. So that's the language that's always surrounding medicine. And I think what
Yeah, it can be, for sure. Anything else? Well, thank you very much for having me. I really, really appreciate it. Thank you. Oh, my mic is still on. I better be careful.
It's a good thing we didn't tell any secrets there. Okay, I think we have some more prizes, don't we? Thank you so much, Tamara. I thought it was a wonderful talk, and I think it's always important to remind us how powerful our words are, and especially at very important and vulnerable times. So thank you very much for coming today.